If you would like to know how to keep your kidneys healthy for the rest of your life, naturally, of course, and if you would like to know how to reverse kidney issues if you already have them, you clicked on the right video. Hi, I'm Dr. Cori Stern, and welcome to my channel, Take Control of Your Health. If you haven't yet had a chance to subscribe, please hit the subscribe button now, as that is my reward for bringing this information to you. If you like the content, please don't forget to hit the like button, and last and most importantly, please share this video with anyone you know that you think will benefit from the information. So kidney disease is extremely prevalent right now, and one of the reasons for that is because diabetes damages your kidneys, and diabetes is so prevalent, but there are other causes of kidney issues, and we're going to talk about that. Before we do, I just want to go over the function of the kidneys, because most people know that the kidneys produce urine, and that is true, but they have so many other functions that many people don't know about. So the kidneys are an extremely important detox organ, and that's part of the producing urine is eliminating toxic waste from your body, but it also plays a large role in controlling some very important minerals: sodium, calcium, phosphorus, and potassium. I want to briefly discuss what each of those minerals do in your body. One of the things that I have found over the years in working with patients is most people know that minerals are necessary for health, but they don't know, first of all, they often don't know what minerals they need, and secondly, they don't know what they do. So let me give you a little information about those 4 minerals. So first of all, you cannot live without sodium, and I have a really good video about that topic called What Happens When You Don't Eat Salt. I will put a link to that video in the description of this one for you to check out. Every cell in your body has sodium channels, and it plays a key role in healthy and normal nerve and muscle functioning. And the amount of sodium in your body also controls the volume of your blood. Now, next, let's talk about calcium. Calcium, most people think of calcium in terms of bones, and it is part of your bones and your teeth, but does a lot of other things. Calcium is important for muscle contractions, including the heart muscle. The heart is a muscle, so it plays a role in maintaining normal heart rhythm. It also plays a role in blood clotting. If you're calcium deficient, you can have excessive bleeding. And it plays a role in the enzymes that your pancreas produces to help with digestion. It needs to be present in order for pancreatic enzymes to be produced. And lastly, it's a signaling agent. So all the cells in the body use calcium as a signal, including your immune system. So calcium deficiency causes immune deficiency. And I talk about that on some of my immune videos. I have quite a few of those. The next mineral that I want to mention is phosphorus. Phosphorus is part of the membrane that covers all of your cells. And it's also an important part of energy production. Some of you may remember from learning this in chemistry or biology, ATP, that's the energy unit that the cells produce. So the P is phosphorus. It also is part of your DNA. Next, we're going to talk about potassium. And potassium helps to regulate your fluid balance. It also helps to signal your nervous system, helps to regulate heart and muscle contraction and blood pressure. It reduces the risk of having strokes, reduces your risk of osteoporosis. It helps to prevent water retention, and it also is important for prevention of kidney stones. So an imbalance of any of those minerals can actually also lead to kidney stones, which we'll talk a little bit more about later. Kidneys have some other important roles. They also help to regulate blood pressure. and they convert vitamin D into its active form, right? A lot of people don't know that. They also produce a hormone that regulates the production of your red blood cells. So all the organs in your body have very specific roles and functions, and they're all really important, but you can see how important the kidney is. So what are some of the things that can damage the kidneys? Well, we already mentioned diabetes, so having high blood sugar can cause kidney damage, and I see a lot of this in my practice. I see a lot of diabetics that have coming in with diagnosed with kidney disease. Also, medications that people take on a regular basis, over-the-counter pain medications, aspirin, ibuprofen, naproxen, ibuprofen also known as, at least in the US, Advil, and naproxen also known as Aleve. There is no such thing as a drug without a side effect. Okay, so people just think it's safe to, some people live on those drugs and they think it's safe to just take them whenever, and it's not. They don't only cause kidney damage. And I've mentioned in my liver video about how Tylenol, acetaminophen, known as paracetamol in Europe, also causes liver damage. So there are natural pain alternatives I can recommend for you. I use cramp bark, I use arnica, I use white willow bark, boswellia. I have supplements that have all these things in them. I'll put links to them on the description of this video. Also, a drug known as an ACE inhibitor, which is commonly prescribed for both heart failure and high blood pressure, can cause damage to the kidneys. So the problem is that high blood pressure can cause damage to the kidneys, and then the drugs, some of the drugs that treat high blood pressure, can cause damage to the kidneys. I do have a video about controlling your blood pressure naturally, and I have a lot of success with helping people with that. Overuse of some antibiotics can also damage your kidneys. There's a lot of drugs, a lot of chemicals that cause damage to the kidneys. Drugs are toxic chemicals, and one of your kidney functions is to eliminate toxins. So you're overworking them. Also, the stuff that you have to drink before you have a colonoscopy to clean out your colon, that liquid laxative stuff, that can also cause kidney damage, as can the contrast that's injected into you, the dye. If you have like diagnostic imaging, like a CT scan with contrast or an MRI with contrast, that contrast is also really toxic. Having heart disease or heart failure also puts a strain on your kidneys. And then kidney stones, chronic kidney stones, can cause kidney damage. So how do you prevent kidney stones? Well, first of all, make sure you stay hydrated. And that's true for all your body organs. Your body is mostly water. So when you're dehydrated, everything has to work harder. But dehydration can increase your risk of developing kidney stones. Also, avoid, if you have a tendency or you have a history of kidney stones, avoid foods that are high in oxalates. So oxalates are something that can contribute to the formation of kidney stones. Some foods that are high in oxalates are spinach, soy, almonds, beets, potato skin, raspberries, and dried dates. I know beets are also good for your kidneys. Cooking reduces the amount of oxalates, so definitely don't eat raw cruciferous vegetables like spinach and kale and broccoli and beets. Cook them. So what are some of the symptoms? How would you know if you might be running into trouble with your kidneys? Well, one symptom that most of my patients have when they have kidney damage is foam in the urine. Okay, now I don't want you, I'm not trying to instill fear in anybody. Okay, if your urine is foamy one time, don't like start getting worried about it. But if you're having consistently foamy urine, or you're having blood in your urine and you've ruled out a urinary tract infection, that's another signal. Sudden persistent puffiness around your eyes and swollen feet and ankles are all symptoms that indicate that you may have the beginning of some kidney issues. The symptoms of kidney stones, it's hard to miss. It's like the worst pain you've ever had, usually in your back, although you can also feel it under your rib cage in the front. And it's not like in your low back. It's kind of in the lower part of your mid back. I can't really show you on right now without standing up, but you know, I have a lot of people come in with pain in their butt muscles and they think it's their kidneys. That your kidneys are not in your butt. They're in around the level of the rib cage. And also with kidney stones, usually you're going to have nausea or vomiting. I've had patients who you know, think that they have a chiropractic problem, that they injured their back and they're vomiting. And then when they're vomiting, I know it's kidney stones. On the other hand, if you have some back pain, even if it's pretty bad, a lot of times it's just a muscle strain or joint injury. So don't automatically assume it's kidney stones. How do you get diagnosed if you think that you're having kidney issues? Basically, it's a simple blood test where they look at a level called GFR, which stands for glomerular filtration rate, and that just shows how well your kidneys are filtering your blood. And then also a urine test to see if you're spilling protein in your urine. So those would be the two ways of diagnosing it. But we want to avoid getting to the point where you need to, you know, get diagnosed, right? We're into prevention mode now. So before I tell you about my ways of fixing kidneys, protecting kidneys, reversing kidney damage, I want to talk to you about the importance of a clean diet, because eating a crappy diet breaks down all of your organs and puts you at higher risk for things like diabetes and high blood pressure, which cause kidney damage. Also, if you eat an inflammatory diet, you're going to end up in pain, and then you're going to take these toxic pain medications, which will damage your kidneys. So if you're someone who understands the importance that food plays in your life, I have good news. There's a site that you can get matched to a small-scale family farm that grows clean, nutrient-dense food, either in your area if you're in the US, or somewhere where they can actually ship it to you. I'm going to put a link in the description of the video. It's www.farmmatch.com/Dr. Cori. Put in your zip code and you'll be matched to a farm either that's near you or that can deliver to you or that can ship to you. Some of them have pickup locations. And if you're in a food desert, they'll ship to you. They do a very good job. They insulate very well with dry ice and you get it really quickly. Outside the US, I have another link, which I'll put in the description of this video. I get almost all of my food from one of these farms, and it's been a game changer for myself and my family and my dogs. The best way to change the world is to vote with your food dollars. So now let's talk about my favorite supplements that help to improve kidney health and, you know, reverse kidney issues. I'm going to do a screen share, which I am technologically challenged, but I hope that it will work. So this is my first favorite supplement for kidneys called Arginex. So the supplements that I'm going to be talking about are all made out of whole foods that are good for your kidneys. Arginex, I call it the kidney roto-rooter, if you know what that is. Like if you're old enough to remember the service that would come and unclog your drains. So the kidneys are a drainage organ, right? And they have tubules in them, and sometimes the tubules get gunked up. So they get gunked up with whatever stuff that shouldn't be there, and then they're not clearing as well. So Arginex helps to clean them out. All right, now the next one I'm going to share is AC carbamide. AC carbamide helps with fluid balance. So it helps to move fluid to where it needs to go. So fluid, like when you drink water, it should go inside your cells. That's how you get hydrated. And if you're drinking and drinking and drinking, but you're not feeling like you're hydrating, AC carbamide will help move the fluid by osmosis. It's a natural process from where it doesn't belong, like let's say the soft tissue where you have swollen ankles or puffy eyes, into the cells. Okay, and next, having trouble seeing my screen here. Next, I want to talk about, how do I get rid of this thing here? Sorry everyone. I told you I'm technologically challenged and can't see. All right, let me just move forward here. The next one I'm going to talk about is called kidney tone. And it's a homeopathic remedy that it has a whole bunch of different things in it for symptoms of kidney congestion, and helping to kind of clean the kidneys out and get them to function better. One of the things that I've been seeing a lot of in the past couple of years, people coming in with itching skin. That can also be, by the way, a sudden onset of itching skin can indicate kidney issues, but it can also be a liver issue. But I'm finding a lot of people with itchy skin and their kidneys are under functioning, and kidney tone to the rescue. It's also great for kids because it doesn't taste bad and it's a liquid. The next one is a stem cell formula. So I do use stem cells. I have one for every organ in your body. This is the kidney formula. These stem cells are made out of sheep cells. They're black sheep cells. And what they do is they help you to more quickly grow healthy new kidney cells. So if you want to, I'll put a link to it in the description of the video, but you can also check out all the other stem cells I have. I have for brain and heart and liver and everything. This one is called Chanca piedra, and this is an herb that helps to dissolve kidney stones and also prevent them. And you see this picture says liver gallbladder support because it also does that. So it's the exact same thing. Some of the bottles say liver, some of the bottles say kidney, but they dissolve stones. They dissolve gallbladder stones. It dissolves kidney stones. You can also have stones in your bladder. So it also improves the health of your kidneys and liver and gallbladder, and it supports your healthy cholesterol levels. And then the last one that I want to show you is, I can't get to it. This is so silly. It's called Rena Food, and I'll put a link to it. Now I can't show you a picture of it for whatever reason. Yeah, because I actually X'd it out. But Rena Food is just what it sounds like. It's kidney food. So it's like everything that the kidneys need to maintain health. So I use all of these supplements a lot because so many people show up with kidney issues these days, even, before it turns into a disease. So that's what we're trying to work on here. So I hope you found this information helpful. Please don't forget to subscribe if you haven't done that already, and hit the like button because it does help more people to find the video. And last and most importantly, please share this information with anyone that you know that might be struggling with their kidneys, or anyone that you love that you want to help with protecting their kidneys. I hope to see you again soon, trying to make more videos. And until I do, please stay healthy.